Hello, everyone. Thank you so much for joining us today. My name is Dan Wuori. I'm the Senior Director of Early Learning at the Hunt Institute in Cary, North Carolina. We are an education policy support to the nation's governors and state lawmakers, founded in 2001 by Jim Hunt, who served 4 terms as the governor of North Carolina. We have been longtime partners of the Reagan Institute, and it is great to be back again this year as a part of the RISE Summit. The topic for this particular session is parental choice during early childhood and how and why policymakers ought to support uh, that choice through what we call mixed delivery systems, which incorporate a wide array of both public and private service providers. To help us unpack the topic today, we are joined by a fantastic panel comprised by some of the most important thinkers and leaders in the field. Dr. Katherine Stevens is the founder and CEO at the Center for Child and Family Policy. Erica Phillips is executive director at the National Association for Family Child Care. And Georgia Mjartan is executive director at South Carolina First Steps to School Readiness. It is so great to have all of you with us. Thanks for taking time out of your busy schedules. Katherine, maybe we start with you. I've sort of started teeing this topic up, but we know that the nation's early childhood systems are ultimately very different from the K-12 system. The K-12 system obviously is, very heavily focused on service provision through local school districts, whereas in the years of early childhood, we have this very diverse system, public and private, of private center-based care and family child care, Head Start, early Head Start, church preschools, home visiting. The list really goes on and on. Talk to us a little bit about this mixed delivery concept. Why is it critical in early childhood, and how does it help to promote parental choice?
Well, Dan, thanks so much for having me on with these two amazing co-panelists. Yeah, as you've just noted, the K-12 system and the early childhood system are at this point really quite radically different in the way they're organized. The K-12 system has, over the last century, really evolved in a direction which has resulted in what we know of as neighborhood schools, zoned schools. You go to school near where you live. As we've been discussing a lot during the pandemic, that's actually been a model that people are increasingly questioning, even in K-12, with a real increase in charter schools, a real increase in even an increase in homeschooling, reflecting the idea that when it comes to children, we really need to put the parental role at the center. That honoring and supporting parental choice, supporting, kind of in on principle, but also practically, is really crucial. So I really see that issue emerging in K-12 to a degree that's unprecedented. What's kind of extraordinary about the early childhood sector that K-12 people don't always entirely understand is exactly what you've just described. It's kind of like for the choice advocates in K-12, early childhood is a dream. It's like an existing utopia from the point of view of people who advocate for parental choice, because it is what we call, in early childhood, we call it a mixed delivery system. And it really is the idea that parental choice is at the center, and that money, it's a lot of private money, and that's an issue which we may touch on. But insofar as there is money, it follows the child. That's how it's described in K-12, is the money follows the child. That doesn't exist in very many places in K-12, although as you guys all know, there's debate around this, but people are working for that. In early childhood, that's the heart of the system. And I'll just say, we may touch on this. I worry that the powers that be in the K-12 system, which are much stronger and bigger powers than in the early childhood system, are actually pushing to increasingly sort of append the early childhood onto the K-12 system. So the teachers' unions are very enthusiastic about doing this. There's other groups that are pushing to make the early childhood system more like the K-12 system, which I think would be unfortunate, because government clearly has a very important role to play. But I don't see a good reason not to put what parents decide is best for their own children at the center of, frankly, of both sectors.
Katherine, thank you. I agree with you. I think there's an interesting sort of contradiction in some of the school choice conversation. And if there is a criticism of the idea of parental choice in the K-12 system, it is that it would potentially drain resources off of public programs into private. And yet at the very same time, there is, has been in recent decades, lots of conversation around expanding that public school system in a way that would drain resources out of this existing kind of diverse early childhood ecosystem. Georgia, you run the state's mixed delivery pre-K system in South Carolina. Why is there a danger potentially in school districts overextending themselves into those early years?
Well, let me begin by talking about a young man named Nigel. This was a 4-year-old who I had the pleasure of meeting when I went out to one of our Catholic school providers in Charleston. And the reason I want to start by talking about him is that, first and foremost, this is not a world in which the public schools are pitted or need to be pitted against the private providers, the faith-based providers, the child care centers, or the charter schools. In fact, in Charleston, South Carolina, Nigel was on a wait list with 500 other 4-year-olds who wanted to be a part of a high-quality curriculum-based 4K program. And so his father was told about this, mixed delivery system, this option at a Catholic school, not the vision that he had ever imagined for his young son. And when I had the chance to go there and meet Nigel and meet his dad, what his father said is, Nigel is thriving. Here was his young son in a Catholic school uniform, and he said he's found his community, he's thriving, he's learning. And so in that one experience, even though it was not the initial vision of that father for his child to go to a private provider, a faith-based provider, that worked for him. And in fact, it worked so well that Nigel stayed on as a kindergartner in that same school. The reason I wanted to start with a family story is, as Katherine already said, that's what it's all about, right? This is not just about what works for businesses or a faith-based provider, which I think is the framing that sometimes comes into play. Are we diverting funds from the public system to, for-profit providers? But at its core, that is not what's happening. What's happening instead is that the faith community, mom and pop childcare centers, sometimes family owned even, right, are stepping up and filling in where there's a need, because there's not space in our public schools, or because families have the desire to stay on in their childcare center where their young child's been going for the past 3 years. I also want to point out that there is an economic driver to this, right? So if all of the publicly funded 4K funds that are currently flowing into our childcare system, our early education system on the private, nonprofit, and faith-based side, if all of those dollars instead were diverted to our public schools, then unfortunately what we know we would see, and we've already seen this with kindergarten, so we have the playbook, we know what we would see, is that many of those childcare providers simply would not be able to continue to keep their doors open. Infant and toddler care is extremely expensive. Childcare providers lose money on those infant and toddler classrooms that are so needed. So if we want infant and toddler care, we must retain pre-K 3 and pre-K 4 programs publicly funded with that additional support in our private childcare centers and our faith-based centers.
Georgia, thank you. And I want to come back to you in a minute and talk a little bit more about the private sector's participation in South Carolina. But Erica, I want to turn to you as well, as we're talking about the opportunity for parents to choose the programs that work best for them and for their children. Family childcare plays such a critical role in that conversation. Talk to us a little bit about the benefits of family childcare and how maybe it meets the needs of at least certain families in ways that maybe other programs cannot.
So thank you for inviting me here to talk about the importance of investing in a mixed delivery system for early education. Family childcare is a term that refers to childcare being provided in an individual's home. More children spend time in home-based childcare than any other childcare setting. And it's critical that we maintain this mixed delivery system that really does honor the choices of parents and where they would like for their children to be cared for. But we also, to be clear, need more public investment in the early care and education system, because sometimes the lack of funding also limits parents' choices. So we represent family childcare. These include licensed family childcare providers, registered providers, licensed exempt family friend and neighbor caregivers, and the assistants and aides that work in home-based settings. Family childcare educators disproportionately care for infants and toddlers, as Georgia was referring to, and also children from low-income families, families of color, including Black and Latinx families, immigrant families, as well as families living in rural communities. And families choose family childcare for a variety of reasons. They're an important building block in our early care and education system because of their unique ability to meet the dynamic needs of working families. One hallmark is they provide very small, intimate care. You have the same 1 to 2 caregivers in a home-like environment. Many family childcare educators have extensive training and experience. They often, many haven't earned higher education or credentials at NAFCC. We have a national accreditation that many family childcare educators work towards. And they're very intentional in the planning in their programs and should be respected as such. So they provide wonderful environments for young children. They also often offer the most accessible options. It can be more convenient, offering flexible hours for people who might need care in the early mornings, the evenings, overnight, and weekends, and also in locations where either parents live or work. And then the third thing I want to highlight about family childcare is that many families prefer the linguistic and cultural continuity that is available, since many family childcare programs are often rooted in the same community as the child's family. But despite their heroic efforts in keeping our country running, and we often talk about the fact that 70% of home-based childcare programs stayed open during the entire pandemic. And so they really were there for essential workers who needed to be able to go to work. Despite those heroic efforts, the number of licensed home-based childcare programs has significantly declined. 10,000 programs have closed in and around the pandemic. And that is on top of almost 100,000 licensed family childcare programs who had closed in the preceding 15 years. And the reason is these early educators, who are disproportionately women of color, are among the lowest paid workers in education and really in the entire workforce. The median childcare salary in 2021 was $30,000. And the pay is even less for the home-based childcare providers who, as sole proprietors, often make far below minimum wage, often just $5 or $6 an hour. Infant childcare is extremely expensive, and they're small business owners who have razor-thin margins and they don't pay themselves. they're working full time, yet almost 40% qualify for public assistance. So given the incredibly low wages, without additional investment, many home-based childcare providers are making the difficult decision to close the doors. Any proposals, any investments to fix the childcare system need to include the mixed delivery and have new resources to ensure that families can continue to have access to the care that they need across multiple options, and that early educators can earn a living wage and stay in this field that they love to do, and that ultimately children have access to high quality early learning opportunities across a variety of settings.
Thank you. And you said something that, Georgia, I want to pitch over to you for a second, because Erica was talking about how the role that family childcare providers played during the pandemic and being able to stay open. I know that was an important part of the story in South Carolina with the private sector pre-K providers as well.
The private sector providers, thank you, Dan, were able to step up and be flexible and move quickly to meet the needs of families. And I think that is what private industry has always done. It's been really responsive to what customers want and need, right? And in this case, what young children deserve, which in that situation was to be open so that they could continue learning and growing and thriving, and so that their parents could return to work. Just like you were talking about, Erica, many of the families that we serve in our state's full day, curriculum-based, publicly funded pre-K program, this is a needs-based program. And so they are children whose parents didn't have the luxury of working from home while providing care to their 3- and 4-year-old children. So they needed to continue working to provide for themselves and their kids. So what our mixed delivery system enabled was, while the public schools remained closed, our First Steps 4K, our pre-K program in the private childcare centers, in the faith-based centers, in the charter schools, in the private schools, they remained open. We were closed for 2.5 months and opened in June of 2020, right? After a very brief closure, we reopened. We opened in the summer. That's another piece that I want to point out. The private side of the mixed delivery system can be much more accommodating in terms of operating year round. We run most of our programs through the full year, including in the summer. We ran full day, 5 days a week throughout the pandemic. And then we also have the extended day option, because we are used to, in the childcare space, right? We're used to meeting the needs of working parents. And working parents expect our providers to be open for 8, 9, 10 hours so that they can go to work. And Dan, I thought about this. I'm sorry. I know I was wrapping up, but I thought about this because I always, think about the outcome. So one really bright spot that I did want to highlight is in South Carolina, we have a kindergarten readiness assessment where every 5-year-old, as they're starting kindergarten, is assessed across a variety of domains. And what we saw was that year, when our programs were open, not surprisingly, the children who participated in continuous learning with that very brief gap were at the very top of their ratings as they walked into kindergarten. They were at the top level of readiness when compared to the kids who had been in a public school program or other programs that had, kind of been on a hybrid model or had even been closed for extended periods.
Mm. So evidence of the value during the pandemic, for sure.
That's right.
Katherine, let me turn to you. There's an aspect of this parental choice conversation that we haven't yet talked about, and I wanted to run it past you, and that is this question of parents who may wish to stay at home with their children. We know that is not the practical reality for a lot of families. That more than 2/3 of young children in this country are growing up in households in which all available adults are participating in the workforce. But there's a couple of things that strike me. One is that we're sort of consistently sort of pitting these two ideas against each other, as though we can support childcare or we can support families who choose to stay at home. And I'm not sure that isn't a false dichotomy. But I think we also have created in this country policies in some cases that sort of actively work against the idea of supporting families who are going to stay at home with young children, even during those critical years. We've embedded, all sorts of work requirements, even to qualify for certain things in this country. So, talk to us a little bit about this idea of how states might go about supporting families who want to make that choice and be at home with their children during those critical early years.
Thanks, Dan. Yeah, I think to me, what we have to put at the driver of policy in the early childhood, in the area of early childhood, has got to be what we know about the developmental needs of young children. We have spent decades thinking a lot about the developmental needs of kids in school age kids in K-12. And we make the mistake of just imagining kind of that same framework, only, their chairs are even littler, right? So the model we have in our head for K-12 is there is a fairly, substantial group of kids, all the same age, in a room together. And that model works quite well in fourth grade and in eighth grade. It's worth pointing out that for many years in this country, there were one-room schoolhouses where there were, sort of multiple generations of kids. That's been a long time. And we're all pretty accustomed to all the 10-year-olds together and all the 11-year-olds together, roughly speaking. That model is not what is best for the development of very young children from birth, certainly to by age 4. I used to teach in preschool. I taught with 4-year-olds. A full day can be overwhelming for a 4-year-old, but they do like playing with other 4-year-olds. 2-year-olds develop better in a home family environment. So, sort of to some of the points that Erica was making, one of the advantages of family childcare, and this is something that people, I think our audience may be people who are largely from K-12. People don't really have a picture in their head of what's family childcare. That is a person, or often a mother and her daughter, or a couple running a little care operation out of their own home. And what characterizes those settings is it's a home. There's a couch and there's a kitchen table, and it looks like home, which is something that little tiny kids do recognize. Very significantly, it is intergenerational. There are multiple ages. So if you go into a typical childcare center, you go into the 2-year-old room and it's all 2-year-olds. If you go into a family childcare home, you will not see 12 2-year-olds. You will see, it might be a group as small as 5 kids or 7 kids, and there might be a baby, and there might be a 2-year-old and a 4-year-old. And one of the things that families really appreciate about this is they're able to put their siblings in the same place, which is obviously convenient for them. But for the development of young children, any parent knows that those relationships between siblings are enormously important, and especially for little kids. So if you're 1 or 2, to be able to be with your 3 or 4-year-old sibling all day, every day, even if your mom and dad are at work, is really valuable. The bottom line is, what research tells us is that children develop, or we're hardwired to develop from birth up to school entry in small groups of familiar, loving people. And whatever environment best provides that is the best environment for young children. So family childcare in some ways has characteristics that are more compatible with what we know about early childhood development. And there actually is research showing that when children are in childcare for an extended period of time, that family childcare environments are developmentally preferable for them. And then finally, the optimal early learning environment for many young children is their own home. And I think part of the reason this subject has not gotten on the radar, Dan, is that the people talking about it are always people like us. We are highly educated. We are very career oriented, or we would not be in these little squares on this Zoom event. And we are outliers in what matters to us. So there's not been a lot of survey research on this, but what survey research has been done has shown pretty clearly that lower and middle income families, who are not super career oriented, that don't have high levels of education, they want to stay home and raise their own young children. That is, in many cases, what's very most important to them. A lot of the surveys showing that people want more affordable childcare are surveys that do not ask people what they would prefer. Would you prefer more affordable childcare, or would you prefer to stay home with your own children? And so given a world in which staying home to raise your own young children is simply off the table for a lot of people, of course, they in many cases are in desperate need of help, to financial help, to put their children in the sort of environment that any of us would want to put our children in. So it's really, I think that that we are first and foremost in these conversations, we're not paying enough attention to what we know about the developmental needs of young children. And second, we're not paying enough attention to the desire, the number of parents who would really like to raise their own young children, and the value of that to our society. Because in many cases, the best developmental outcomes are produced by children spending the first 2 or 3 or 4 years in their own home. So I really appreciate you raising that, and it's challenging to put back on the policy table, but I think it's really crucial.
Be mindful that we don't have a ton of time left, and I want to get to a couple of other things, but just to sort of close that loop, Katherine, are there policies that you think we'll have policymakers in the audience? What would you recommend in terms of how we can better support families to make that choice? Because I think you're absolutely right that, as I said in the opening, the practical reality is that this is sort of off the table for a lot of families right now.
That's right. That I don't know, Dan, of there are people thinking about this. I don't think anybody has done this yet. When we're talking about high quality childcare, but when you're talking about paying strangers to take care of your children, when we're talking about the government, public dollars subsidizing that, we're talking $15,000, $20,000 a year. And so the policy conversation is around coming up with $15,000 to $20,000 a year to fund paid strangers to take care of people's children, which in some cases is very important, right? Really needed, and right. So it's one idea that people have talked about is using public dollars, federal dollars or state dollars to subsidize the wages of one worker if the other worker in a 2-worker family steps out of the workforce or just reduces to part-time for a couple of years. I wrote a proposal for allowing families to take an advance on the child tax credit to help them afford to stay home for a year or 2 years or 3 years. If you provided just simply a grant to families of a certain amount to enable them to either use it for childcare or to stay home, that is another option. There's, of course, all kinds of questions about to what extent someone was attached to the workforce before. There's a lot of complicated issues, but I really hope that policymakers start thinking about this, because I think it's sort of self-evident that to live in a country where people can't raise their own kids when they want to doesn't seem like where we want to be ending up.
Can
you.
I
And Eric,
jump in on this from a
please.
state level, if that's okay? Because I think South Carolina has done something really innovative here, which is over 2 decades ago, South Carolina recognized the primacy of parents in their young children's lives and said, you know, it's not just a matter of having the time, it's also a matter of having the skills and resources to be great early educators for their young children. And when we did a recent survey, that was validated once again. What we heard from parents was, I want to be there with my children, and I also want my children to have that educational intervention, that educational experience early on. And so that's where home visiting programs come into play, parenting education programs. So again, for over 2 decades, the state of South Carolina, before there were ever federal dollars flowing into our state to fund home visiting, the state of South Carolina raised our hand and said, you know what, we're going to use state taxpayer dollars to deliver evidence-based, research-based home visiting programs where a parent educator, a coach, a support system comes into the home of families who want to be their child's first and best educator. Programs like Parents as Teachers, a home visit every other week for up to 2 years. And these parents are in fact learning the skills that get their children ready for school success. Again, those data points prove that kids who got these programs in the state were 75%, 74% more likely than their demographically like peers to start kindergarten at the highest level of readiness. So we know that parents can do it. They just need that extra support. So I think that's one really important policy intervention. And I was in a lot of those meetings with the Build Back Better Biden administration where they were talking about childcare and pre-K, and I kept raising my hand and saying, what about the parents who are home with their young children? And where is the home visiting? Where is the parenting education in this? This is equally as important.
I have a question for you too.
I would also love to jump in that, and I really appreciate the framing around this. Not all parents have options, have that ability in order to stay at home with their children. And at the end of the day, it is about trying to provide families with as many options as possible. So I think that home visiting is incredibly important lever. Also, the child tax credit is an incredibly important support for families. And, you know, and just thinking about the research, and one thing that we do know is some families, particularly families where Black children, are more likely to have all available parents in the household working. And Black parents are also twice as likely as white parents to suffer setbacks at work when they can't find childcare. And so I do, you know, think it's really important to look at this through the experiences of multiple different families, and really make sure that we're providing the resources and support to families, and to not require work restrictions on some of the programs that they need so that they can stay home in order to care with their children as an option. So I just find that there's a lot of common ground around having supports for families.
Absolutely. What I've been trying to ask Erica on the policy front. You know, it strikes me, and we see stories all the time of communities, frankly, that have made it harder to be a family child care provider, right? That there are local zoning ordinances, or there's homeowners association restrictions around the creation of family child care businesses. What would you say to the policymakers watching around how they can help to sort of improve the soil conditions for family child care in the country?
Great. I'll just share a couple of quick things here. One is, we certainly should remove barriers like restrictions on offering family childcare in homeowners associations or in public housing, and to also be mindful of zoning ordinances and requirements that might add restrictions or burdens that are overly complicated for family childcare. So we definitely work with our partners in different states to advocate for changes like that. And also balancing with that we don't want to decrease regulations that could actually harm children or caregivers. And so regulations that might increase the number of children that can be cared by one person might have unintended consequences of reducing that small, intimate feeling and the ability of the caregiver to provide that individualized attention. And so there are certainly some opportunities where we can work together to address those obstacles that are faced by family childcare. Two other things, because you talked about the actual cost of care and the fact that our child care system right now is funded, the public subsidies that we do have are funded on what's called a market rate, which is what parents are able to pay, which is often actually much less than the cost of childcare. And so a couple of things that we've seen that have really supported childcare and family childcare and being able to run their programs is providing grants. I mean, over the pandemic, we had historic relief for childcare through the American Rescue Plan. The Child Care Stabilization Program supported more than 9.5 children in having access to care. And we did a survey with the National Association for the Education of Young Children and found that 40% of family child care providers who received the grants said their programs would have closed without the support. And as many of those pandemic relief stabilization grants are coming to an end, we are seeing an upcoming cliff where a significant number of child care providers and programs are very unclear about the future and whether or not the economic challenges that child care programs were facing before the pandemic will continue to persist afterwards. So the last example of ways of supporting family child care providers I just want to point out is providing high quality public funded pre-kindergarten programs in home-based settings. And that being another way to provide options to families as well as to build the sustainability of family child care programs. And we are seeing more states that are enrolling children, publicly funded pre-kindergarten enrollment options for children in home-based childcare programs, which we think is a really great practice and would like to see more of that across more states.
Erica, I'm so glad you brought that up because that's, interestingly, that even in states and frankly, most states at this point in their pre-K programs have incorporated some form of at least limited option for mixed delivery service provision. But even in states that, may have very robust private sector participation in those pre-K systems. In some cases, family child care is excluded entirely in favor of more kind of, to Catherine's point earlier, the sort of the 4-year-old classroom, right? The classroom-based model. So I think that's a really, really important issue to raise. I'm sensitive that we're getting very close to our time, but I want to give each of you just one moment. And we've talked about all of these, all throughout our conversation today. In closing, maybe just 30 seconds apiece, if there was one thing that you would say to the policymakers that are watching today around how they can either expand and promote parental choice, or as may be the case in early childhood, sustain the existing model, because that has been, the parental choice really in early childhood has been the long time model. What advice would you give them as sort of the most important place to start? And Katherine, maybe I can start with you.
Yeah, I guess the first thing I'd say is what we all know in our own lives is developing new humans is a very time and intention intensive process. We're not just talking about kids going to school. We're talking about developing new humans. And I think it's become fairly common knowledge that the first, especially 3 years, are of foundational developmental importance. We know this in our own lives. And then when we're thinking about sort of masses of kids out there, we forget that we've got to think about the needs of young children and policy responses in a very different way. I would also like to just underscore for policymakers that the K-12, which we spend in this country, $800 billion, or almost on the $800 billion on the K-12 system. It has many large interest groups. And there's a lot on the one hand, you can see how just sort of just sort of encompassing early childhood into K-12 system. In some ways, it seems like it would make sense, but there's a lot that would be lost. And I think that we're kind of right at the moment where it's important that policymakers really keep that in mind and bring people like Erica and like Georgia to the table to fully understand what could potentially be lost by just kind of starting to append early childhood to the K-12 system.
In the last 45 minutes, we have talked about myriad options: home-based care, a mixed delivery system with faith-based providers and private childcares. We've talked a lot about the role of public schools. I think we mentioned Head Start at one point. There are so many options, and we have only talked about one piece of that early childhood pie, which is the early care and education piece. So imagine being a parent. Imagine being a new mom. I remember when I received the moment where I got the call that there was a 4-day-old baby waiting at the hospital for me. We were foster parents at first. And so, new parents, we didn't know the system. We brought home this 4-day-old baby. And then we learned that there was this incredibly complex, convoluted, and oftentimes very siloed system. So we've just talked about a lot of complexity. The hard part of that is it doesn't make sense to families. If it was hard for you watching this to navigate what we were talking about, all these different fund sources and different eligibility criteria, and the public dollars pay for this, but not for this, imagine how it is for that mom bringing home her 4-day-old baby, right? And I was a person with a master's degree and a car and a spouse and a lot of privileges that allowed me the time and the resources to be on the phone, to drive to bureaucratic government offices, to figure out how to navigate this system. So my advice to policymakers, to state leaders, and to our federal leaders as well, is let's make our system transparent, efficient, and navigable for families. We've done that in South Carolina. We launched a single comprehensive eligibility screener for 44 different early childhood programs, from home visiting to childcare to pre-K. Even food and nutrition supports like WIC and SNAP are a part of that. And then just last week, we brought online a common single application that values the time and the intellect and the resources that parents have, so that they don't have to go to a bunch of different government agencies to complete a whole bunch of different applications. They can do it in one place. We are doing that in South Carolina because we know that when parents have their time back, they will use it to invest in their young children, to go to work, and their kids will get the access to the resources that they want, need, and deserve.
Georgia, thank you. Such an important example. Erica, I'm going to give you the last word.
Thank you for that. And I agree, Georgia, that is such a great example. What I would share is that in this country, for young children, the most prevalent setting for young children is in home-based childcare environments, whether that is a family member, whether that is a licensed family childcare program. And so we need to ensure that any systems that are developed really do make space for robust public investment in home-based care options. So I will keep it short and sweet with that.
That we are just about out of time. Please join me in thanking Dr. Katherine Stevens, founder and CEO of the Center on Child and Family Policy, Erica Phillips, Executive Director of the National Association for Family Child Care, and Georgia Mjartan, Executive Director of South Carolina First Steps to School Readiness. It's been great to talk with all of you today. We are grateful to the Reagan Institute and grateful to all of you for taking time out to participate in the RISE Summit. We'll see you soon.